my name is Vanessa Johnson. I am in the course NUR 420-201, Nursing Policy, for my BSN degree. In this video, I will be making a testimony to the rising rates of preventable pressure injuries among the geriatric population in inpatient units. A problem I have firsthand experienced is rising rates of preventable pressure injuries among the geriatric population. This population is more likely to have more fragile and delicate skin due to natural age processes like structural changes in the epidermis and decrease of skin elasticity. With patients, there can be comorbidities, certain medications, and poor lifestyle and nutrition sources that can reduce the skin's integrity. Skin deterioration, such as pressure injuries, have become a rising issue among hospital organizations nationwide. Many of these pressure injuries are preventable with proper assessments, safe staffing ratios, and appropriate resources. Skin breakdowns lead to lengthened hospital stays, infection risks, and increased healthcare costs for the organization. Issues that are relevant and could lead to this issue are unsafe staffing ratios and inadequate mandated staff education. With improper staffing, healthcare delivery is not at its best. There is not a way to have a heavy patient load and to deliver efficient interventions at a timely pace. I believe that implementing policies of mandatory staffing ratios and appropriate resources is essential to improve skin integrity and overall patient care. The bill H.R. 3415, introduced this past year in 2025, called Nursing Staffing Standards for Hospital Patient Safety and Quality Care Act, is a bill supporting safe nurse-to-patient ratios in hospitals. This bill identifies inadequate nursing staffing as a major threat to patient outcomes and also jeopardizes the delivery of quality healthcare. The bill being introduced itself shows that there is an issue in multiple organizations with staffing. In the article Nurse Staff Levels and Patient Outcomes, they conducted a study focusing on the relationship between nurse staffing levels and patient outcomes in acute care hospitals. Evidence is consistent with higher nurse staffing levels being associated with lower patient mortality. The findings of other outcomes such as infections and pressure injuries were less clear due to limitations, but the authors concluded that the overall evidence supports the proposition that higher registered nurse staffing is likely to lead to better patient outcomes. To conclude, the rising rates of preventable pressure injuries among the geriatric population in inpatient hospital units represents a serious and avoidable threat to patient safety and quality of care. Evidence clearly demonstrates that many of these injuries can be prevented by including adequate staffing. As healthcare professionals, we have both an ethical and professional responsibility to advocate for policies that protect our patients. Implementing mandatory staffing standards is not a workplace issue, it's a patient safety risk. By supporting legislation and institutional policies that ensure proper staffing, we can reduce skin deterioration, strengthen healthcare delivery, and uphold the standard of care that our patients deserve. Thank you.